Now, the reason I mentioned it's already in effect is on New Year's Day, Congress took a $24 billion bite out of that number and lowered it from $109 billion to $85 billion. And they did it in the usual legislative way that's kind of convoluted. But the effect is that that started the process. So for the last month, whether you know it or not, agencies are operating under a slightly lower ceiling. In this case, it was only $4 billion less out of that $1 trillion. The other thing Congress did was they said, we're going to take the rest of, we're going to take $8 billion and apply it to 2014. And then we're going to take the other half and find some revenues. But the main point is sequestration has already started. It's now a question of how are we going to get to the next point and the next point and the next point after that. So again, you'll probably hear the president say, if not tonight, then certainly, you know, as he campaigns or as he travels around the country, that we don't need sequestration, we can find balanced cuts. Now, Toby will talk more about that, I'm sure. That's code for, instead of cutting discretionary spending, we need to reduce entitlement programs. And most of that is health care, specifically Medicare. Again, keep in mind you've got the ceiling on discretionary spending, and then you have mandatory entitlement spending, and then you have spending on loan repayment, again, mandatory. So this is the category from which all the research and education programs come from. But it is, in the larger context, it's part of what Congress has to spend every year. So we talked about how big the cut would be. Again, you're going to hear different numbers. Originally, that $109 billion translated into 8.2% reduction. Then after the New Year's Day legislation, it went down to 6.4. Then in the next month, in a way that, frankly, I've never understood, and maybe you have insights, it went from 6.4% to 5%. And then this week, OMB put out additional guidance, the first time they've spoken in weeks, and said, well, it's not really 5% because it's going to be applied over 7 months, so the effective rate is 9%. So you can pick a number. 8.5, 6.5, 5, 9. As far as I'm concerned, one is as good as the other.